Good evening. Welcome to a brand new episode of BMC Global Live AlHilal Health World Nothing But Lifestyle. I'm Jasila Mujib. Your health is our priority. So, in each episode of this talk show, we bring before you an expert doctor from AlHilal Hospital to address your various health issues. Acute knee pain in young adults is very common these days. To discuss this issue, we have with us Dr. Chethan Kashivasi from AlHilal Hospital, Hamath Town. He is an orthopedic surgeon and his area of expertise include hip and knee replacement and surgery of the spine and fracture surgeries. So, let's welcome doctor to the show and move on to the topic. So, doctor, what is this condition and how common is it now?
This is actually, in medical terms, we call it as chondromalacia patella. It is quite common. I see at least 2 to 3 patients every day about this sort of a pain. It's actually the pain in the front of the knee joint, especially in young females who are like 20 to 40 years, sometimes most of the times who are overweight. They get this pain and it's usually acute onset. They start like today, they are fine, tomorrow morning when they get up the pain is there. So it is like that. And there are so many other conditions which can actually mimic this condition, like jumper's knee, the lateral compression syndromes, early onset osteoarthritis. All those things can actually mimic like this, but they are proper diseases. But this one is chondromalacia patella as such is a mechanical condition because of the problem in the kneecap. There will be some damage in the kneecap. Because of that, they have this knee pain, which is the pain in the knee joint, especially in the anterior part of that is the front part of the knee joint.
So, it's very common now.
It's quite common, yes, especially in females, in young females, it's quite common. And most of them, they actually come to me with the fear that they have started to have osteoarthritis because their parents or somebody has osteoarthritis. So they come with the fear.
Okay. Now you mentioned about the kneecap. Doctor, can you explain what is the kneecap?
Kneecap is just a small bone within the muscles of the thigh and the leg, in between the around the knee joint, in front of the knee joint. It's within the muscle. Actually, it helps in gliding of the thigh muscle over the thigh bone, and it is very well attached to the thigh bone with the strong thigh muscles, and to the leg bone with the patella tendon. So it helps actually in lifting the leg up on the knee, and it actually takes the because it helps in lifting the leg, it actually takes the whole weight of the body. Especially when you try to get up from sitting position, when you try to climb stairs, the whole weight of the body comes on this small bone. It takes the whole weight
on the kneecap,
on the bone itself, the bone itself, and the cartilage under the bone. In the common language, in here it is called gadroof. So it will be like too much pressure on the cartilage, and that is actually the cause for this particular problem.
Okay. So can we consider this pain as a disease?
I generally wouldn't consider it as a disease. It's more of a overuse syndrome, and some minor lifestyle changes and some what are the mechanical issues which is actually causing the problem. If we can change that, it is not a disease, it is more of an overuse syndrome.
So doctor, what are the causes of this acute knee pain in young adults?
There are no particular cause for this. Most of the times it happens because of some improper positions, like sitting for long time in the wrong position, like sitting in congested spaces, driving in congested cars where they have too many people sitting in the car, and you are touching your dashboard or the front seat, your knee is touching, and sitting for long time, especially when you sit on the ground and do something for long time. You do exercises in wrong positions, you do some sports without any proper warm-ups. All these things can actually cause the pain to start. But there are some problems, like if the chances of you getting this pain will be high if you are a young adult, and if you are because the cartilage is very thick in young adults, so your chances of you having the pain is more. And also the overweight, your weight as such, the amount of weight you put on the joint actually makes it matters. So these are the actual causes for the pain.
So you mean the overuse of this knee causes this knee pain?
Yes, something like that. Yes, it's not like overuse. It's more of like you do some regular work in an improper position. You do some regular work for a longer time. You do some regular work in some improper way. So it is more like you can take it as overuse syndrome. Yes.
Okay. So doctor, can you explain this anterior knee pain? What is this anterior?
Anterior is just like front. In medical terms, anterior means the front. So the pain is in the front of the knee joint, in the kneecap, under the cartilage, and under the kneecap, the cartilage, which is because of some improper position, the cartilage which is there under the knee joint, under the kneecap, is becomes softened. It becomes soft, and because of that, every time they do particular movement, there will be like too much pain. The excruciating pain will be there, like they can't sit on the ground and try to get up, they have pain when they climb stairs. That actually the softened part of the soft part of the part of the cartilage which has become soft, it will just touch the thigh bone, so they get that sudden shock like pain in the knee joint.
You have already mentioned that young females are getting this pain, but I would like to know more about who all are prone to this knee pain, and
Generally,
and also the risk factors associated with this knee pain.
Yeah, it's mainly predisposing factor. What mainly we can take is the overweight and young adults. Young adults, especially females. We commonly, at least I see 90% of the patients I see with this pain, they are females, and especially in 20 to 40 years of age group. It doesn't mean that other patients can't have. It can even happen in 10 years, 12 years like that. It can even happen in like 50, 60 years. But usually it is 20 to 40 years age which they have, because the cartilage thickness is always very cartilage thickness is more in this age group, and especially females, because sometimes it's more like, because females they do more work like sitting on the floor, so the chances of them getting this is more. The males generally they don't do too much work sitting on the floor.
Household work and
household work and all usually females take care of. So I think that's one of the reasons why females get this pain more. And generally structure of the females, maybe there are some structural changes in females in the knee joint, so they are predisposed for this. And other common thing is the overweight. Being overweight, the amount of weight you put on the knee joint as such is too much, so the chances of you getting the pain is also high. And there are other conditions which you need to like consider in every case, like the jumpers, skiers, and active sports people who are actively involved in sports, but they don't regularly do this warm-ups and physiotherapies for the this one before doing the sports. They are usually predisposed for this sort of a knee pain.
Okay, doctor, any other condition that present like this?
Yes, that is one of the actually most feared part of the discussion, I think, because most of the times we just consider you just have chondromalacia, fine, just do some lifestyle change, you will be fine. But then we need to consider so many other conditions, especially the early onset arthritis, especially in the 30 to 40 years age group. People, so many people tend to have early osteoarthritis. We need to rule out, because the treatment as such will differ in those patients. And second thing is like there is one rare condition called synovial plica syndrome, especially in like very young people. The lining within the knee joint, actually it gets stuck between the thigh bone and the leg bone, and they get that excruciating pain which stays for few days and goes off. This actually can repeatedly come, and it's very much treatable condition. It needs a surgical intervention. So we need to consider so many other conditions which can actually present like this. But yes, most common is chondromalacia, which is treated easily, but then other conditions need to be considered. We need to rule out other conditions as well.
Doctor, as we know, acute knee pain is the main symptom. Any other symptoms associated with this condition?
Actually, the patient comes with most pain is usually the secondary complaint. Most of the patients, they come with acute swelling in the knee joint. Suddenly, yesterday I was fine. Today morning when I get up, my knee is swollen. I don't know what it is. They come with that fear that they have got something like osteoarthritis or some uric acid problem or something like that. Is the fear with which they usually come to me. And the pain is actually more only when they try to climb stairs or when they sit on the ground and climb up, try to get up from the sitting position. That is when they actually have the pain. But the problem mainly is the swelling. So usually the swelling is the main symptom, I would say, and then pain is the one. Other than that, usually they are otherwise healthy. Sometimes yes, overweight, but it will not be like a symptom or anything. But then yes, overweight is one of the things we see in the clinic. But pain and swelling are the main symptoms.
So pain and swelling are the
main symptoms.
Symptoms. So doctor, what are the tests to be done to confirm?
Generally for chondromalacia, 1 to 2 tests. One is the Overuse test, which is the Overuse mainstay of diagnosis is clinical examination.
Okay.
Most of the times we diagnose it clinically, but then frequently we need x-rays just to check if there are any structural problems, like sometimes there will be shallow groove of the thigh where your kneecap need to glide on. There will be it will be shallow. They have some structural problem, like they can have some problems in the ankle, flat foot, like that. They can have problem in the hip joint. They can have some deformities in leg. They had some previous injury, they had fractures, and there are some deformities in the leg. They can have deformities, and there can be muscle imbalance, and so that because of that the kneecap as such will be in some wrong position. We call it mall tracking, mall tracking of the patella. So those things we can actually, and there can be structural, like we call it knock knee. People who have knock knee is like their knees are touching from inside. So those people, x-rays have some role to play, but then diagnosis mainly is clinical. To rule out any other conditions which can present like chondromalacia, we need to do x-rays, but other things we can do is maybe MRI. MRI, yes, maybe sometimes it will be helpful, especially in chronic patients where they don't have relief even with like months together. The pain is repeatedly coming, and even with medications and physiotherapy, lifestyle change, pain is not coming down. We may have to do an MRI scan to check if there is any problem with the cartilage or other things.
So what are the treatment options, doctor? What are the options of treatment?
To start with, I usually put them on some rest, ice, and then some simple medications like painkillers, anti-inflammatories for few days, maybe like a week or 5 days, like that. And the mainstay of treatment will start after 5 days once the pain settles down. That is where the actually treatment starts. It's like physiotherapy, sports physiotherapy, and the gait like walking styles and corrections, and they need some postural advisors like how to sit, how to do your work, about how can you modify your they usually come back like saying that I'm usually doing this work, how can I change it? We usually advise on how you can do some modifications like that. If they are using something like Asian style of toilets, I generally advise them don't use that. That is maybe that is the reason why you are getting this, change it to like Western style of toilets and something like that. They are the mainstay of treatment, and that has to be like followed for long time. If they don't follow that, these are the patients who actually they don't follow these instructions. They come back with recurrent episodes of pain. Recurrence can happen even once there is a pain, it can always recur because they are predisposed for that. But then if you make these lifestyle changes, the number of times you get this recurrent pain will be very, very less.
Okay, so along with the medicine, you have to go for lifestyle modification.
Medicines are mainly like only for because there is swelling, pain, you are in fear, you want that pain to just go off. That is the mainstay. But then the mainstay of treatment will be like this one, the physiotherapy and lifestyle changes.
Okay, so what is the outcome of the treatment? I mean, what is the prognosis of this knee pain?
Prognosis generally it doesn't. Chondromalacia as such is a self-limiting condition. That means it will settle down by itself over time. Even if you don't do any treatment, just wait for few days, it is going to settle down. It is not going to get very bad, or it is not going to progress into osteoarthritis like generally people fear. People fear that now I got knee pain, so I'll get osteoarthritis. It's not like that. But then most of these people have these predisposing factors for osteoarthritis also. So you need to be careful. Just do some lifestyle changes. Most of the times the outcome is really good. The outcome is really good. Few days you need to take medicine, do some lifestyle changes. They can live happily with it without any problems.
Okay. So doctor, any advice from your side for our viewers on managing the knee pain?
First thing, whenever you have pain, take advice, because it may not be like as simple as this. As I explained, like anterior knee pain, it can be anterior knee pain can be because of so many other conditions like early osteoarthritis, compression syndromes, meniscal problems. So many things can be there. First, we need to keep a proper diagnosis. So whenever you have pain, just consult. It may not be very severe, but just consult, because we need to rule out other problems. If it is diagnosed as chondromalacia and it's anterior knee pain, what we are discussing, just need to do some lifestyle changes. Just avoid sitting on floor for long time. Try if you are driving for long distance, just avoid driving for continuously like more than half an hour, 45 minutes. Like if that is the case, just take a break for some time and then continue. And like don't climb stairs too much, especially like skipping and climbing, like 2 stairs at a time. You skip and climb stairs. Those things you need to avoid. And other things. Just you need to do some exercises, which generally when you consult first with the doctor, they will just advise. They can just advise you on what exercises you can do to strengthen your thigh muscles and the leg muscles, so that the pain will not recur. Need to do the exercises regularly, make some lifestyle changes, and again overweight. Overweight is other problem. Just try to reduce your weight as much as possible. A person with 80 kg having problem and a person with 120 kg having problem is always a different one. The same problem at a person 80 kg, a person with 80 kg will be less for a person with 120 than the person like compared to person with 120 kgs. So weight reduction is one of the main. Have proper balanced diet, exercises, daily walking, and like reduce some oil stuffs, do some disciplined lifestyle like getting up in the morning and having food at proper timings, doing some exercise regular time. All this will help in reducing the weight as such.
Okay doctor, now you have told us about the medicines and physiotherapy. Can we go for some surgical options for this pain?
Surgical options per se for chondromalacia patella is generally not needed. Most of the times it's not needed, but there can be few healthy patients who have like problems with the kneecap, like maltracking, with where the patella is not in proper position, or if the groove of the thigh bone is not very very shallow, it's not very deep, so that the patella will easily come off, or some patients will actually have had dislocations in the back, in the previous, like few years back they had a dislocation. So these patients may need some surgical arthroscopic intervention like lateral release. Sometimes we need to shave off the cartilages, and if it's chronic conditions where the pain is too much and the pain is not getting better with lifestyle changes and other things, sometimes it happens. They will need some cartilage surgeries. There are so many other like mosaic plasties, cartilage surgeries we can do with arthroscopy now. So very simple procedures can be done, which will help, but 99% of the times we can manage it without surgeries. And then surgeries again may be needed if the diagnosis is something else, like some osteoarthritis, some other plica syndromes, lateral compression syndromes, meniscal problems, all those things, they may need surgeries, not per se for chondromalacia, but then we see especially when we are doing surgery for some other conditions, we see there is some softening of the cartilage in the patella and other things. We see that, but generally we don't intervene about that. We don't do anything for that.
Thank you, doctor. Thank you for being with us and discussing this relevant topic and giving us a lot of valuable information about this knee pain, and it's very common these days. So thank you very much. Thank you once again.
Thank you very much. Thank you.
So viewers, I hope this was quite informative. As doctor said, now with proper lifestyle changes we can manage our knee pain. Stay happy, stay healthy. This is Jesila Mujib signing off. Good night.